My name is Hannah Decker, and I'm a general surgery resident at UCSF and a national clinician scholar working with the Benioff Homelessness and Housing Initiative. Together with a team from UCSF and Stanford, we wrote the article, "Is Gaining Housing Associated with Improved Cancer Outcomes Among Unhoused Veterans? Results from a National Sample." We investigated the following question. If a veteran gained housing in the year after diagnosis with lung, colorectal, or breast cancer, was that associated with better all-cause survival than remaining homeless? We looked at over 100,000 veterans diagnosed with cancer from 2011 to 2020. 5% of this group were unhoused at the time of diagnosis, of which just over 20% gained housing in the year after diagnosis. 1% of veterans who were housed at the time of diagnosis lost their housing in the following year. And what we found is that continually unhoused veterans and veterans who were housed but lost their housing had worse survival after cancer diagnosis when compared to continuously housed veterans. But for the group of unhoused veterans who gained housing in the year after a cancer diagnosis, their outcomes were actually similar to those who had never been homeless for lung and colorectal cancers. This finding held true even after we adjusted for differences in the groups, including stage of diagnosis. This finding is important because it shows that gaining housing is associated with better outcomes after cancer diagnosis versus remaining unhoused. One reason might be because being housed makes it easier for patients to complete guideline concordant cancer care, which is often complicated and multidisciplinary. This work has several policy implications. The fact that more than 20% of unhoused veterans gained housing in the year after being diagnosed with cancer underscores the VA's sustained commitment to addressing veteran homelessness. These efforts have driven a marked reduction in homeless veterans, far outpacing the general unhoused population changes in the U.S. Adopting some of these strategies in other settings where unhoused people seek care, especially in patients with cancer, might help improve outcomes in this vulnerable population. To learn more about what my study found, you can read it in the February 2024 issue of Health Affairs.